Hi, I'm Dr. Nicolai Lennox, and I want to talk to you about something a little unusual. I want to talk about long-term care. Now, most of the time people come into a chiropractor's office or a doctor's office, even natural medicine doctors like myself, and they want a relief for a symptom. This is not a talk about that. This is talk about where do you want to be in 5 years, in a year, in 10 years. What's going on in your health, and how can you make one little creative step at a time, just like a long-term investment for your health, to increase the likelihood that you'll have an outcome that's better than it would otherwise have been. Now, I've been in practice 37 years, and I can tell you with absolute conviction that the patients of mine who have had regular care over many, many years. Now, I don't talk about weekly care. I'm just talking about over the long term, regular care, regular dietary consultation, regular nutritional care, regular visits in which I talk to them about their health. They have better health outcomes as they get older than people who do not have that care. I just need you to know that, because health is dependent on a lot of different factors. We're learning more and more all the time about the kinds of things that produce pathology, the kinds of things that produce good health, the kind of things that produce bad health. And what I want to tell you is the stuff you do every day on a regular basis throughout the week, throughout the days, throughout the months, throughout the years are tremendously influential on the outcomes. And by outcome, I can tell you, for example, this year I'll be 65 years old. And I can tell you that the kinds of situations that I have and endure and enjoy have a lot to do with several features in my life. One, they have to do with my genetics. Genetics are the things that you have. There are some things that you genetically deal with, and that's that. But I can also tell you that the circumstances of the things that happen as a result of your genetics can be dealt with in lots of different ways. I can also tell you that how you feed yourself, how I fed myself over the years, makes a difference to how I feel. I can tell you the kind of care I got made a difference to how I feel. And what I want to talk about is this. If we just start with the notion of you dedicating a year to improving your health, I guarantee you that unless you have something that's determined to go wrong in your body that we can't avoid, you will have better health, because the body just responds to that stuff. So here's the kind of thing I'm talking about. I'm talking about after you're not looking to do, what am I going to do about my elbow? What am I going to do about my neck? My low back hurts, blah, 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 blah. I'm talking about once the care for symptoms is resolving, what do you want to do about your health care long term? So what I propose is this. We do laboratory tests and evaluate via lab tests what your general health presentation is. We do an exam about thyroid, we do cholesterol testing, we do red blood cells, white blood cells, vitamin D levels, all that kind of stuff that you would normally find in a rather complicated lab test. What's different is this. I've been trained by people who have done some very, very, very deep studies on lab tests on how to recognize patterns of health and patterns of ill health in lab tests. So we can be fairly predictive about how things will go unchanged in your lab test. And we can intervene with nutritional supplements, and we can intervene with dietary changes, and we can intervene with other kinds of techniques. And these are very, very important things to know, because if you take the same lab evaluation to a standard medical presentation, they'll say they're all within normal limits. What I'm telling you is that we can look at them as patterns of interactions within the lab tests and understand more about your physiology that way. That, combined with muscle testing, understanding what your body wants to deal with, what your body's sequence of care should be, because just because you have 6 things you want to fix doesn't mean you can just go fix 6 things. The body will rebel about that kind of treatment. So, understanding sequence of care, and you might want to look at another video I have specifically dedicated to sequence of care. Dietary evaluation, there's a way of that eating that suits your physiology. Not everyone needs to eat the same kind of food. There are people who thrive as vegans. There are people who are vegans who have no business being vegans. There are people who don't like to eat meat. Sometimes we find people don't like to eat meat because their digestive system is underfunctioning and they're simply protecting themselves from bad digestive problems. We can identify that both on the lab test and with muscle testing and put you on the right kinds of supplements so you can digest your proteins better. If you don't digest your proteins better, it's very, very hard to rebuild your body. So, long-term care is a critical kind of thing that we can think about, because if you will invest in putting the work into systematically with the help of a trained professional like myself, to do one step at a time to improve your health, you're almost guaranteed of a better outcome. And the people who have healthier outcomes in their 60s and 70s and 80s, should we decide to live that long, are people who will oftentimes have put the kind of care on a regular basis to daily, monthly, habitual care that supports the way their body likes to function. I offer that to you, and I almost dare you to take advantage of it. Thanks.